Good afternoon and welcome to all of our community members in attendance. How are we feeling today? Ready to see some action?
Yes!
And thank you again as well to our legislative colleagues who have taken the time to join us, being Senator Megan Coleman, Representative Scott Slater, Representative Cherie Cruz, and Representative Terry Korshban. Today, and Representative Lauren Carson. Because today we are gathered as a community to have a very important conversation around a contemporary human right, that being public utility services. Because we know that everyone in our community should be entitled to have access to electricity services and gas services, especially in combination with the ongoing cost of living and all the different expenses that our neighbors have to account for. But we know we're far from that reality, which is why we're going to have a conversation to go a little further around some of the different pieces of legislation that have been introduced this year. A piece of legislation that would guarantee a payment percentage income payment plan for those households on fixed incomes. Legislation centered around caring for our seniors and those who are terminally ill and are struggling to afford their utility bills. But before we dive into some of the hardships that our communities are experiencing, before we dive into these conversations as to how we're going to advocate for solutions, and so now as we prepare to hear from some of our invited utility policy experts, again, just want to thank those powerful words that came from a spoken word artist right in our community. Now I would like to welcome up Representative Cherie Cruz, the House sponsor for the Serious Illness Protection Plan, which is House Bill 5068. But before I do, I also just want to recognize and thank Representative Jennifer Stewart and Representative Kathleen Fogarty for joining us as well. We appreciate the solidarity. And of course, Representative Rhode.
Thank you, and I have the honor to introduce our next speaker. Charlie Herrick has been a senior attorney at the National Consumer Law Center for 24 years, specializing in energy and utility issues. He represents consumers before regulatory agencies, testifies at legislative hearings, and provides legal and policy counsel to low-income advocates, legal service lawyers, and government officials. He also devotes much of his time to training lawyers, advocates, and frontline social service staff regarding the rights of utilities customers. Much of his work focuses on energy efficiency issues, including federal appliance efficiency standards, climate change, and advocacy for larger and smarter energy efficiency investments in affordable multi-family housing. Charlie currently serves as the Commissioner of the Board of the Melrose Housing Authority and is the member of the Equity Working Group of Massachusetts Energy Efficiency Advisory Council. And prior to joining NCLC, Charlie was an Assistant Attorney General in Massachusetts, working in Utilities and Insurance Division for 16 years. He's also worked at the Massachusetts Law Reform Institute. Charlie Herrick is also co-authored with Olivia Wine, Protecting Seriously Ill Consumers from Utility Disconnections, What States Can Do to Save Lives Now. I want to introduce and welcome up Charlie and thank you for being here.
So first of all, let me say, all you folks in Rhode Island are too nice. Could you come to our Massachusetts legislature sometime? But a couple of thanks. One to Camilla for inviting me here, and to all the good folks from the Wiley Center. My office, the National Consumer Law Center, has worked with the Wiley Center for more than the 2 decades that I've been there. And thanks to all the elected folks who are here to listen today. And for the wonderful words from our spoken artists. Wow, thank you. So let me start by saying, why do we want to protect seriously ill folks? So I'll share 2 stories. One in 2018, PSE&G, which is a utility in New Jersey, shut off a woman who owed $51. And her family had been communicating with the company that this was a seriously ill person who had an electric-powered oxygen tank, and she died. And actually a law was passed a year later in New Jersey named after her to try to improve the serious illness protections, just as you are doing here to try to get new laws passed. The second one, same year, temperatures were above 100 degrees in Arizona, And a 72-year-old was shut off for a balance of $177, and she was found dead a week later. And I'm sure there's any number of stories that we don't find out about at NCLC, but this is what happens when people lose their utility service. I want to share a couple of other things. Many low-income folks live in public and subsidized housing. It is a lease violation to not have utilities. So there are low-income people who think in the summer, I don't really need my gas, but if they don't have utilities, they can be evicted, so they lose their housing, and that just creates the spiral of homelessness. Also, one of the things I've worked on a lot in the last year with a doctor from Yale is the cost of operating some of that durable medical equipment, the oxygen concentrators, the ventilators. Depending what the piece of equipment is, and you're in one of the most expensive states, say in Rhode Island, it can easily cost hundreds of dollars a year if you need that kind of equipment and it needs to run 24/7. So there's the fact that their bills are much, much higher, they're much more vulnerable, and they can be shut off. And we shared an article, I think Camillo might have shared it with the elected officials, about the cost of operating durable medical equipment. Something you all know very well, I also live in a very expensive state, Massachusetts. Housing costs there are ridiculously high. And so let's assume that two-bedroom apartment, if you're lucky, you find it for $2,200 a month. That would be 50% of the income for a three-person household living at 200% of poverty. And in my world, many of the clients that come our way, 200% of poverty is the high water mark. A lot of them are below 100% of poverty. So I do that as a little context as to why we would want to protect seriously ill folks. So let me just take a few minutes then to talk about best practices and a couple of comments on the actual bill before you. One, and this is all in the executive summary that I think Camillo has shared, there should be a broad scope of who's protected. The medical professional should be able to decide who's seriously ill. It's not up to some utility company employee to do that. Two, and I would urge this as a change to your bill, not only have doctors able to sign it, but nurse practitioners or physician's assistants. I don't know the law around those other categories of medical folks. Hey, I have good health insurance, I have a decent job. I don't have a doctor at the moment because my doctor's on leave. The person who actually would know my medical condition is my nurse practitioner. And so in many states it includes nurse practitioner or physician's assistant. Also, the customer should be able to assert the protection when the person's at the house to shut it off. So if there's an employee, and I don't know if you have remote terminations in Rhode Island, we don't in Massachusetts, but if there's an employee at the house, they should be telling that person, you have the following rights, and if you assert the right, we will hold off the termination and we'll give you whatever it might be, 7 or 14 days to get the documentation. And in the bill, and this is good, the doctor can initially do it by phone and follow up with documentation, but the person in the house should be able to say, I have a serious illness, I need some time to document that. Another good thing in your bill is it certainly allows a reasonable amount of time for the initial protection, and it's 3 months. And that's like Massachusetts and some other states, and that's a good benchmark to have. Also, my colleague Olivia Wine, who co-wrote that report with me, often focuses on how does that person know they have these rights? And so I don't know what the general practices are at utilities in translating documents, but documents should be not only in English that explain your rights, but in other commonly spoken languages. And again, on how does a person know about these rights? They should be informed when they initiate service, but most people aren't going to read all the paperwork when they sign up for service. It is extremely important that termination notices list the rights against, to protect against termination. Certainly that's the standard practice in Massachusetts and many other states. You know, there's monthly things that go up, but there's also termination notices. People pay more attention to those. They should state what your rights are to protect you against termination. There are also some states that go out of their way to require the utilities to do affirmative outreach to try to identify who might be eligible. And so in some states, you can't shut off someone over 60 or 62 or 65 without letting the commission know that you're going to do that because we're worried about those folks, or if the person had previously had a serious illness. And a couple of other things. The protection should be renewable if the condition persists, and you do have that in your bill, and that's good. And then there's one that's near and dear to my heart. Comes up rarely, but it's incredibly important. Is the protection portable? A lot of our clients have to move frequently. Are they going to lose the protection just because they moved, or can they tell the company, I'm moving, I have a protection, I'm going to get service at the new address? And unfortunately, even in Massachusetts, it's a gray area, but often we can get that protection. I urge you to think about that. And last, I do have one comment about the bill, and Camilla said I could raise it. It's a suggestion. On line 10 of the bill, it suggests that notices can go either to the company or the division. And to me, that creates the potential for customer confusion and slowing things down at the utility. That is, it's the utility that has to know you have the serious illness. And so it seems to me all of the notices should go to the utility company. I don't mind if there was a duplicate going to the division, but if a customer's confused and they just send it to the division, it's going to slow down when the utility learns about it. Other than that, I'm thrilled that you got this bill. It is a good bill. I hope you get it through. And if there's any other way that we can help, we're close by. I got here in about an hour, so thanks for having me. I should say one other thing. I have to get back to Boston for something, and this hour the traffic's really bad, so if I step out, it's not because I don't want to stay for all of it.
Safe travels.
We're actually hoping we can keep you for a minute or two
No.
for a few Q&As.
Yeah, I don't have to leave immediately, but I know that I can stay for
Okay,
all
yeah.
of it. Oh, I should
Stand
stay
podium
up
if you
there.
don't mind.
Sure.
So I'm Senator Megan Coleman. I have the privilege of carrying the bill in the Senate. Thanks for being here, and thanks to the George Wiley Center for your work and your organizing. You make Pawtucket proud. So I want to open the floor, but while people think about possible questions, I have a question to get us kicked off. So with possible federal utility changes that could impact our utility costs, how are other states stepping up to think about these issues, and is there anything that we should be modeling ourselves after in that sense?
You stepped into the gigantic elephant that we are all afraid of.
Oh, I know. Sorry, it's a specialty.
But I'd say, number one, when President Trump was previously president, he proposed to zero out fuel assistance. So I think you need to do all that you can do, and your senators have actually been incredibly good on fuel assistance, and I think you just need to remind them how important it is we have adequate funding for the fuel assistance program, because it is by far the biggest source of assistance, as well as PIPs and discount rates, but the fuel assistance is incredibly important. We should also be concerned, since they've talked about wiping out the Department of Energy. No, the Department of Energy is still going to build nuclear weapons, no matter what happens, but they might not have a weatherization program. So I think you need to step up for the weatherization program. I mean, there's many other things that are concerning, which is, wind, which is very important for plants in this state and plants in my state and most New England states to address climate change. We've already seen the stories that wind machines, some of the developers are kind of backing away and waiting to see what happens. There was a project in Massachusetts that's already been put on hold. So I don't have a great answer, but part of my own political work I'm doing, I'm a 501c3, so let me make sure I say the right things, but is we need to let our elected officials in Congress, and again, you have good elected officials, understand how much we're behind them and how much we want them to be vocal. I'm sorry, that's the best answer I can give you.
Yeah, great. Maybe one more, and then we'll open it up to the floor. So how do these kinds of utility reforms protect the state's finances from, for instance, the social costs of utility shutoffs? Can you give us some illustrations there?
Sure. Because I'm on the board of my housing authority and I straddle energy and housing work, the one that bothers me is someone getting evicted because they are living without utilities in a way that's not terribly unsafe, but it's a lease violation. Again, the people who think, in the summer I could live without that gas bill, that's one of them. The ones I told you, which is, I'm asthmatic. I've been living on my nebulizer. If somebody cut my power off, I'd be in the hospital and somebody's picking up the tab. And if it's a low-income person, it's a government program that's picking up the tab. So there's the health harms, there's the homelessness harms. If you lose electricity, I don't know how your kids get their homework done. I don't know how young people really do okay without electricity. I think adults can deal with it at some level, but I think there's tremendous harm to young people as well. So there's a lot of social harms that land in people's lap, and my colleague Liz actually, I'm sure, can add stuff later about that because she's also well versed as a frontline legal services attorney.
Thank you. Are there questions from the audience? We have time for one or two more, I think. Anybody? Yeah.
Sure, why not?
Please.
Hi, I'm a social worker, I've been a long time. I have two quick questions for you. One is it up to Rhode Island Energy or the PUC or both for what's happening now? And how can we help advocate, like with prices and you know, what's the best way to advocate? Is it through PUC or the Rhode Island Energy? Because we hear that both of them are the bad guys. And then the other one is, can we make sure that Rhode Island Energy has resources for people who are being cut off or when they come to cut off, to give like a 211 card so people know where to go for help?
So on the first question, your utility commission regulates the rates, and you have more of a chance of success in moderating rate increases by being visible and noisy before the commission. You know, the Wiley Center could speak more to whether you'd have much chance of success with Rhode Island Energy itself. On the second one, you know, utilities have different cultures, we used to be a national grid state. We are a national grid state. We're an Eversource state. You know, some utilities actually, I will actually quote a high-level utility executive who said, Charlie, if you can get the not willing to pay, we'll take care of the people who can't pay. And we just need more of that philosophy that there's people who can't pay. And so we need to get them resources. And in a sense, it's in the company's own interest to point you to fuel assistance or any other resource that's available as opposed to, I'm going to shut you off. There was another utility executive, and boy, does this go back years, and this was outside the box back then. He had a picture of a hammer and a nail, and he said, you know, when you have a hammer, everything looks like a nail. And he actually piloted a different model of connection. He actually hired social workers, and he compared the percentage of the billed revenues that he collected to other companies. He collected more money because he was engaging with the customer. And he had lower admin expenses than other companies. It wasn't like he was throwing money at social workers. He thought, you know what, maybe there's another approach besides hitting the nail really hard. So that is worth a discussion. I don't know, PPL, I guess, owns Rhode Island Energy. I don't know that company. Liz does. If I can say Liz Spivey, you can. But PPL may be a difficult company on that score. I'm happy to introduce anyone here to folks in Massachusetts at the utilities who have that approach that they're poor, they can't pay. We gotta do something other than just threaten to shut them off. I'm not saying shutoffs don't happen. Believe me, they happen. But there's different corporate philosophies about how to deal with this social problem. This is fun, I'm insane.
I think we have time for one more question if there is anything from the audience.
What's going to lower costs?
Well, boy, is that a tough question to answer. The answer is, I don't know. I think between the urgency of climate change, one, what data centers are doing to spike load incredibly. I mean, just a quick aside, I assume some of you have heard of Google. When you Google something these days and it says AI provide an answer, that uses large amounts of energy, and all those data centers are driving up rates. So as a low-income advocate, I focus a lot on fuel assistance program discount rates and PIPs because we got to do what we can to protect the low-income folks. It is much harder to change the overall cost of the entire utility system. That's a tougher nut to crack. I wish I had an answer, but that's the best I got.
Thank you very much.
Thank you.
Thank you so much, Charlie. Next up, we will be bringing the ongoing champion for percentage income payment plan, that being Representative Scott Slater from Providence.
Thank you, Representative Morales, and for your support and for your helping me in this effort, and all my colleagues that are here today. Thank you for being here and for your support on these issues. I have the honor today to introduce Elizabeth Marks. But before I do that, I'd like to also thank Camille for all your support and your work, and the George Wiley Center, and everyone that's here today for coming out and being here and being present at the State House when we have our hearings and telling your personal stories, which I know sometimes is tough to do, but it's extremely important for my colleagues and for others to hear from the public. So thank you for doing that, and thank you for being up here year after year fighting for these important policies to help low-income individuals, especially with their utilities. But Elizabeth Marks, who's I think online with us right now, Elizabeth, thank you, has been executive director for over 5 years and is supervising attorney of the Pennsylvania Utility Law Project. For over a decade, Elizabeth has worked to advance energy and utility justice through litigation, targeted policy advocacy, training, consultation, and creation of support services. She was responsible for leading PULP's statewide litigation of energy and water cases on behalf of low-income Pennsylvanians. She also assisted with the creation and launch of PULP's statewide utility assistance hotline, which now assists hundreds of Pennsylvanians to avoid termination or reconnect to service each year. She is committed to achieving PULP's mission to ensure that low-income Pennsylvanians can access and maintain safe and affordable utility services in their home. She has a substantial background in family, utility, and housing law. Elizabeth serves as a chairperson of the Low-Income Home Energy Assistance Program Advisory Council and the Department of Community Economic Development Weatherization Assistance Program Policy Advisory Council. She is also a member of the Public Utility Commission's Consumer Advisory Council and Department of Environmental Protection Climate Change Advocacy Council. So thank you, Elizabeth. Thank you for the work that you've been doing, not only for Pennsylvanians, but for all of us, because it's so important to have a program that's up and running in Pennsylvania with the same utility company we have in Rhode Island. And the great thing last year, for the first time of my years of submitting, there was not resistance from Rhode Island Energy like there has been in the past. So thank you. I will turn it over to you, Elizabeth. Thank you.
Well, thank you so much. Thank you for the warm introduction. I too want to come and work in Rhode Island. I'm sorry I couldn't be there in person today, but Harrisburg had other plans for me. We have a much different, very large legislature in the middle of session. I'm going to share my screen if I can, but the room just went blank, so I want to make sure that you all can hear me.
Yeah, we're still with you.
Oh, great. Awesome. So I'm going to share my screen because I have a couple of slides for you today. I'm going to talk, as it was mentioned, we have, I have a long history of working with PPL Electric, both as a litigant on the other side, as well as hand in hand. I serve on their, my team serves on their advisory committee, and so we have a lot of experience. We also have a lot of experience with PIPs because we've had one in Pennsylvania for a very long time. We've actually had a number because each of our utilities, and we probably have more utilities in Pennsylvania than most other states, possibly all other states. The consolidation has not happened in the same way here, so we deal with a lot of different program design and have a lot of experience in that. You've already heard an introduction of me, so I'm going to skip right over who the Utility Law Project is, but what I'll say is we are happy to partner with George Wiley Center on all kinds of things. We've known Camilla for a very long time and are happy to provide assistance as needed to the Rhode Island legislature. If you ever have any questions about how things work in Pennsylvania, I'm happy to share. Just for some context in terms of how many households in Pennsylvania that need services and who are struggling to afford energy. This is from a 2022 study. Obviously, energy prices keep going up, but back in 2022, we had roughly 1.4 million households with energy burdens exceeding 7% of their income. the lower the income, the higher the energy burden, meaning the percentage of income that somebody pays of their household income towards energy costs alone. That's just home energy costs, not your gasoline in your car. This, if you're paying 33% of your income just on home energy costs, you have very little left over to pay for housing, food, medicine, medical care, child care, communication services, all of the things necessary to engage in our community. I also have to mention, I mentioned this in all of our presentations because we need to keep saying it. Communities of color have higher proportional energy burdens than white communities. We see this across the board, and the driving factor here are differences in housing quality, which has a direct impact on how much water and how much energy you use in your home. Consequences, you've already heard a lot about it, so I'm going to go right through because I really want to be able to answer your questions and talk a little bit more about Pennsylvania's, how we got to where we are with our PIPs and our well-developed bill assistance programs. But you heard from Charlie, right? Negative health outcomes, both in the short term and the long term. We also have interruption in family unity. I'm a former family law attorney, worked for the Pennsylvania Coalition Against Domestic Violence for many years, and we saw judges actually switch custody of a child to a batterer, who was convicted of abusing their spouse. To the judges, in some cases, it is safer for a child to live with a batterer than to live without electricity or running water. These are challenges we need to address. We also have a lot of involvement of children and youth services. Somebody asked a question about costs. That's another one of the hidden costs. When you don't upfront in a preventative way address utility insecurity, you end up with these costs, and it costs taxpayers a lot more than it costs ratepayers to support a rate discount program such as a percentage of income program. You have the obvious loss of refrigeration and food in your fridge. We have clients all the time who lose their electricity. They lose all of the SNAP benefits that they just used to go buy food to put in your fridge. Freezers, everything goes bad. That is another cost on the family. It's a cost on the system. And of course, housing. And Charlie mentioned this, but it's worth underscoring just for a moment that the costs of rehousing are tremendous. Once you lose utility services and you're out, or your home ends up in foreclosure or condemnation, because when you don't have running water, you don't have energy, you can't really live in that home safely. We saw a lot through the pandemic of constructive eviction, where landlords are actually using, and this is illegal in Pennsylvania, but it happens quite frequently, where a landlord will call and shut off service to a household in order to try and evict a family and get around the system. Real tremendous impacts to housing. You can lose not only your public housing in that moment when you're evicted, but you can also be precluded from receiving public housing in the future. And private landlords, I'm not sure what the laws say in Rhode Island, but in Pennsylvania, public landlords use those eviction records to exclude people from being rehoused in private housing. So even if you don't lose your public housing or you're not even eligible, we have long wait lists in Pennsylvania, so a lot of folks can't get public housing, but it makes it very difficult to be rehoused. So Pennsylvania, this is why I'm here, right? Rate assistance programs were initially established through rate case litigation back in the 80s, right? Following the high gas crisis in the 70s, and in 1992, following the issuance of a comprehensive report by our Bureau of Consumer Services, which is embedded within our Pennsylvania Utility Commission. They found in that report that the need and effectiveness of establishing comprehensive universal service programs as an alternative path to traditional collections necessitated a policy. So that policy, what we call our CAP policy, or Customer Assistance Programs, was passed then. It set guidance for how each of the utilities should structure their customer assistance programs. In Pennsylvania, we have well-established caps dating back to the late 80s, and they have two main components. They have a rate discount, which gets you to an affordable monthly bill based largely on your household income, and then that adjusts every month or every quarter, and it's either your percentage of income or your average bill, because sometimes someone's percentage of income, what the bill would be, is actually a little higher than their average usage. So we have that little feature built into our programs to make sure that CAP participants are getting the lowest available rate at any given time. We pair that rate discount with arrearage management. I know you have a debt management program in Rhode Island. Ours in Pennsylvania vary across the state. They're either forgiven 12, 24, or 36 months. The key there is providing debt forgiveness. It works if you're also providing rate assistance. If you don't have those two components working together, you're not addressing the underlying problem, which is how households got into the arrearage, right? The management program works because we are providing a targeted level of affordability based on what the household can pay going forward. So it incentivizes, as Charlie said, it like takes the hammer out of the hand, and it looks at a preventative-based approach. It gives households a reasonable target in which they can work off that debt by making it full payments on their reduced bill, right? Another important component to our programs that I'd be remiss if I didn't mention is the need for pairing these programs with whole home efficiency and weatherization. This targets, in Pennsylvania, we target our high usage CAP participants for our low income usage reduction programs. And that's a cost control feature because, when you are providing this level of rate assistance, you want to make sure that those that are very high users, because of housing conditions and other, inefficiencies in the home, that you're addressing that and driving down the cost of the program overall. So those components really work together to provide a suite of prevention-based programs. Fast forward, I'll say in the 90s, when Pennsylvania deregulated our electric markets, what was a commission policy became statutory law. And what our legislature said was, we're going to enshrine those universal service programs, and we must maintain them at least at that level. Then our policy kind of sat for many, many years, and in 2019, our commission issued revised policy statements lowering our energy burden standards. This was following a whole look at what energy burdens were in Pennsylvania, finding that the average household has about a 3 to 4% energy burden, while low-income households had upwards of 30%. That's the data I started with. So Pennsylvania, after that the switch to reduce energy burden standards, they're up on your screen now in terms of where we're at. Now, in combined heat and electricity cannot exceed 10% of household income. We have programs for both our electric and our gas, and combined, those two have to get to a combined no greater than 10%, or for the lowest income households, 6%, which is the energy burden that we believe is the most effective because it is based on a more precise level of affordability. Just want to give you a couple of last pieces of data here to keep in mind. Our customer assistance programs, these rate discounts and PIPs, the average household income of somebody enrolled in Pennsylvania's customer assistance program is just $14,872 a year. That's very little income. So what these programs are doing is serving very, very low income households. In terms of what the sources of income, we track all kinds of data. And so I didn't have a chance to go too in depth on all the different demographics or how our programs are working, but I'm happy to provide any of that information to you as you consider and weigh passing your own PIP. I would very much encourage you to do so. But really who these programs are serving are the working poor, folks who are in retirement, relying on Social Security or pension, and folks who are disabled. And that makes up well over 75% of the households. Just 2% enrolled in our customer assistance programs are relying on public assistance. Last stat I want to give you is what our enrollment looks like across the state. So only about the CAP programs reach about 20% of our estimated eligible population. We're serving about 319,000 households, just under 320,000 households across the state. You can see that PPL's number, they're serving 71,000 households in their percentage of income program, right? That's a big number. And if we can do it in Pennsylvania, I'm quite certain that they can do it in Rhode Island. We do have roughly across the state about 5.1 million residential customers, and about 1.2 million of those households are low income. So, we do have ways to go, and it's important to create pathways to these programs for greater prevention. They can't alone fix this problem, but with good collections, billing, termination policies that are also focused on prevention, you can get there. One last note, our program review, I think, I really hope that you do go forward and pass a PIP in Rhode Island, but what I'll say, is you gotta pay attention to those programs then. And so just to share what we do in Pennsylvania, there is our periodic universal service plans, and this outlines the nitty-gritty of the program, right? The benefits, the eligibility, the enrollment, recertification process, and the administration. That's subject to periodic review by our Public Utility Commission, which is then open to public comment and engagement. We also have annual reporting requirements. This allows us to figure out who's using the programs, how they're being used, how they're funded, and how they're working. And we can make adjustments from that. There's also third-party evaluations of the programs every 6 years. And we have well-established universal service advisory committees established at all of our utilities, where folks like me, consumer representatives, commission staff, and utility staff talk about the programs, have insight into them, and engage. And I'll say PPL in Pennsylvania has one of these universal service advisory committees, and they're just good practice to make sure that the community has a channel to sit down and talk with the utility about what they're seeing in the community and how they can better shape the needs. So with that, I would love to answer any questions you have. It's just a pleasure to be here today, and I would welcome anyone to reach out to me if you have follow-up beyond this event.
Elizabeth, thank you so much for that informative presentation, because not only was it informative, it was a perfect example to be able to demonstrate that these ideas are not radical by any means. Because clearly PIP has been established and successfully implemented in Pennsylvania with the same utility carrier that is now here in Rhode Island, known as Rhode Island Energy, formerly known as PPL. I want to be conscientious of the time, but I want to make sure we have a space for any community members who have questions related to what Elizabeth just presented on.
Sure.
To our social worker in the room.
I had a question on your slide about consequences of utility insecurity. One thing that really comes to mind is lack of dignity, and I was just wondering if that, strikes a chord with legislators. I know it does with you in the room, but when you're doing your advocacy over there in Pennsylvania.
I think it depends on the legislator. It really does, and what group you're talking about and talking to. I wish it struck a chord with everyone because it is a matter of dignity, but I'll say we've been pushing for summer protections from termination for quite some time, and I've been told by legislators that can't people just open a window, and so that's not helpful in Pennsylvania. Parts of our state get very, very hot in the summer, and we have increasing death, especially among seniors. So, dignity, I think, is a great advocacy piece with some legislators, but unfortunately, not everybody sees it that way. So, when we're talking with folks like that, we look to the numbers, which is, these programs really do. Prevent a lot of uncollectible expenses, which is the other piece, right? They have real impacts on collection costs, which are borne by other ratepayers. Utilities are quick to shut off. Why? Because they can collect all of those uncollectible expenses. But when you keep people turned on and you give them an opportunity to pay what they can afford, then you have more folks on the system sharing the costs, and less costs get written off in the long run. So, great question. I think it really depends on the audience in terms of whether or not dignity is going to win the day. I wish it did every day.
Yeah, thank you.
So, Liz, just following up on what Heidi had said, I think it's an important question that she asked because I ask myself the same question as I'm presenting this piece of legislation every year. But do you have anything in Pennsylvania? I know you said the review process. Do you have data that you can provide to us about how it's been working in Pennsylvania and exactly the piece that you just hit upon about collection and preventing people from getting shut off? So anything about future rate increases, because we know the utilities don't eat these costs. What happens is they wait and the uncollectible costs, they pass on the rate increases in the future. So the folks the biggest argument I hear a lot of times is, oh, you're putting this burden on other middle class folks to pay for poor folks. But the reality is we're paying those fees and probably more in the long run when the shutoffs happen and when the utilities go to collect those uncollectible in their rate increases. So do you have data on showing that there's rate increases in the future have been lowered by having a PIP program?
I wish that I did have something like that I could point you to immediately. There was a recent study by our Public Utility Commission in terms of our energy efficiency programs that quantify the reduced collections of energy efficiency programs and the reduced collections costs. There are piecemeal data for each utility. In Pennsylvania, we have a patchwork. We don't have just, we have 5 different major electric utilities, and all of them run slightly different programs. So I don't have anything that fits the bill exactly, but I can follow up with a couple of different resources that would give you an idea of some of that, right? Nothing quite as square.
Yeah, thank you, because I think that'll be helpful and important for our hearing this year.
Yeah, absolutely.
Awesome. Well, thank you again so much, Liz. We appreciate being able to have your presentation, and most importantly, just being able to hear your experience as someone who has been on the ground and has witnessed the implementation of PIP in real time. So as we begin to close out, I need to ask the community members in this room, are we feeling fired up?
Yes!
Are we going to fight for PIP and SIP so it is law this year?
Yes!
So this is our call to action. We have heard directly from the experts between Massachusetts, between Pennsylvania, that these ideas can exist, that these policies do benefit working people, families, and our vulnerable seniors when they're actually passed and implemented. So next week, we're going to be on our legislative break. So I want to challenge everyone. Next week when things are calmer, please start taking the time to think about your lived experience, to think about the experience of a loved one who has suffered at the hands of greed from the utility companies, and start thinking through, how can I go to the State House to share that story, to tell legislators in committee that it is now the time that we have to pass a serious illness protection plan and a percentage income protection plan. And then, when we come back to the State House in late February going into March, we're going to extend the invitation through the George Wiley Center to make sure that you are aware when PIP is up for a hearing, when SIP is up for a hearing. And this energy, this collective energy that we have gathered today, we hope to see again in a few weeks. So can we count on you to show up to the State House, be on the front lines, and advocate for these changes?
Yes.
And I think this will be the year for passage for PIP, SIP, and for the working people of our state. And we want to thank you all again for being here. So please make sure to stay in contact, stay informed through the George Wiley Center, because we will continue collaborating with them, partnering with them, and most importantly, making sure we finally pass these bills. Thank you.
Yes.